Good morning. Welcome to Viewpoint, that startling program. What do we do up here? Personalities.
You got me. I just you to honk and I go get in the car.
Personalities,
Was there more to it?
and perspectives. Let me repeat that because I was overridden by my co-host. Personalities, politicians, and perspectives. Well, again, we got a great personality with us this morning. Some perspective about ourselves and what's going on in our community. Mr. Cavi, you'll recall that we always try to start Viewpoint with a kudo or two, some individual or organizations that contribute to the well-being of our community and do certain nice things. At the risk of getting fired, which could be an imminent risk, my kudo this morning, Judith, this will kind of surprise you. We didn't talk this over. We usually try to discuss our kudos and so forth and have an agreement. But this is coming right out of the blue for you, Judith K. My kudo this morning would be the fellow who gets up at the crack of dawn, comes to the radio station here up on Lazy Row about 4:15, 4:30 every day, puts in a 12-hour day. Excuse me, please, I get all choked up talking about this. No, seriously. Serves the community in a great way. Couldn't do it without his cat. But
his faithful sidekick.
Faithful cat, Mabel. But seriously, Jim Ash has been a fixture in the communications profession here in the county for many years, and does indeed perform a fine service for her here. And he hasn't threatened to fire me, nor am I asking for a raise. It's just
however, one would be appreciated.
No, seriously, I sit here Wednesday after Wednesday before we go on air, and I watch Jim work here, and I think, gosh, he comes in at the crack of dawn or before dawn now, doesn't leave. It's about 12 hours later, and that's commitment. Of course, it's his job. But every employer would like to have an employee like Jim Ash that you can count on day in and day out.
And sometimes I wonder if these young people who happen to be our children and our grandchildren would be able to make that kind of commitment. They're kind of me-firsters.
Yeah,
they really are. There's a whole generation out there who really doesn't give a toot about anything other than the way it affects number one,
Right.
Yeah.
And it's a shame. Was that naughty of me to say that?
Well, you'll probably get Human Relations will probably call you in for a conference.
2 out of 3 of my kids like me.
The old days were called the personnel office. Now they fool around. I tell you, the things that we do in this society in the name of, quote, political correctness, sometimes just mind-boggling. Speaking of politically correct, we probably should bring our guest on this morning.
Well,
we rode him all the way up here.
He'd like to say something, too. Yeah.
I'm just glad to be here. It's good to see you. It's always a pleasure.
You're
always
just
a pleasure.
kind of like me, just proud to be here wherever you are,
Absolutely.
right?
No, I love. It's every time I come, it's always fun to be here and fun to talk. And I'm just glad you have me here.
Bless your heart.
Yeah.
Don Cavi is the head of the Logan County Department of Public Health and has been for how many years now? You've been here with us in the big city for a bit.
Yeah, I've, just over 3 years. I took over as administrator, been at the health department since 2009. So I was here on the show before I was the administrator, but in the environmental health capacity because I was environmental director at the time. So, yeah.
Mark Hilliard, was he precede you, or we have one in between?
That's correct. Mark Hilliard was the previous administrator. So.
Wonder if Mark's retired yet. He went to Springfield to go to work.
Matter of fact, just had lunch with him yesterday. He's doing well. Yes,
that's interesting.
And I bet he wishes he were still here, doesn't he?
Oh yeah, he's keeping busy with his retirement,
I'm sure.
and which is good. So,
but
he's doing well. He's doing real well.
Well, there are certainly enough topics going on right now in the health field for us to talk about. One, of course, I think the elephant in the room is this flu business. With these children dying and the awfulness that's taking place, and another that's happening and going to continue to happen is in Springfield we have an outfit called the Legislature. You know,
they
think
still
I've
around?
heard of it before.
Well, they were. I don't know about today.
Are things any better for that?
Any news flashes, Jim? No, nothing. Yeah, they're there.
Are we better off for that or not?
Well, they're addressing a situation about the smoking business. You know, I think most people in their misspent youth probably smoked. I did for a long time. Well, then it came to pass that it was about as socially acceptable as I don't know what, something bad. And I thought, well, what the hey? The only place you can do it is in the privacy of your basement, so why should I do that anymore? Well, now they're talking about raising the age at which you can buy tobacco products from 18 to 21. Now, I suppose you'd applaud that, wouldn't you?
From a public health perspective, anything that minimizes the use of tobacco or encourages people not to use it, absolutely. You know, I think public health as a whole would be behind something like that.
But I suppose it's not much different than it was 50 years ago. If you were 12 and wanted to smoke, you could find some cigarettes, right?
Yeah.
Yeah.
Yeah, you do see a lot of younger kids, and even if they're not 18, they're going to figure out. Some of these kids are going to figure out a way to get their cigarettes. But it's unfortunate though, and we all know how bad tobacco is, and as a public health person, if we have to do what we can to promote, that people are at least aware of the dangers of tobacco, and certainly if they want to move to that age, then I'm not going to oppose it.
Right. Well, conversely, that same outfit who's thinking of raising the age at which you can purchase tobacco products is talking about legalizing marijuana. Now, is that a lot healthier?
Well, from some of the reading I've done, marijuana actually does contain chemicals in it that are, not good. Anything you put in your lungs isn't going to be good for you, you know. So,
but you see, there's a lot of if they legalize that and tax the living daylights out of it, it's going to be good revenue for the state of Illinois. And
which they'll manage to throw away some way.
Pardon?
Which they'll manage to throw away some way. If you recall.
Yeah. But that's the reason that we do these things in Illinois is for the money. We don't worry about the health of people.
Interesting thing about marijuana. It seems those who know, done studies on it, seem to believe, and apparently it's so, that there's a certain medicinal plus in using marijuana. And therefore, we have now what we call in the state of Illinois and a couple other states, I think, medical dispensaries, marijuana dispensaries. And I'm familiar with that because my son, in his second job, is managing one of those for a friend of his who owns it up in Canton. And it's remarkable, truly remarkable in every sense of the word, the sales that these places have. $3,000, $4,000, $5,000 a day is not unusual, and they have to come from, they don't all come from Fulton County, for goodness sakes. They come from a long ways around. So those folks who are using that and buying it obviously feel that a lot of good is being done, or they wouldn't be there as customers.
Yeah.
The medical profession seems to think that, well, someone at least, that there are medicinal values there. So that's interesting. Do you know much about that, Don?
Well, I can tell you that, there is a push for medical cannabis, and they have, it has shown to at least, people that are in a lot of pain, it does seem to help. But I will stress the fact that if people want to their doctor to prescribe medical cannabis, that they have to go through a series. They have to apply to the state. They have to prove they have a debilitating condition, and they have to register through the state to be okay. Yeah. Because you don't want anybody off the street just getting medical cannabis.
Oh, it's so well controlled that you can't even. They have point of sale thing like coffee cups and T-shirts hanging on the wall. And without the card, I mean, Joe and Josephine Smith can't just go in there and buy something. You have to be registered by the state and the doctor and all that. Yeah. So it's pretty strictly controlled.
Yeah, there's about, from what I read, there's somewhere around 30,000 people in the state of Illinois that are prescribed to medical cannabis. So it's not just a little, not just a few people here.
Well, if they get it legalized, though, you won't even have to have a hangnail. You can just go get it.
Well,
and pay taxes.
I think as far as medical cannabis, though, there's going to be a lot of restrictions on that. I mean, you're going to have to go through a lot of hoops just to get a prescription, even to get registered to be eligible to get that from your doctor. So, but we'll probably see more and more, at least medical cannabis. The recreational stuff, I kind of stay out of that area. But it'll be interesting to see how that goes. What happens on the medical side?
I don't know the correlation between starting with cannabis or marijuana, and then graduating, if you use the word not advisedly, to something stiffer like heroin, and then that leads down to and you just wonder about that spiral where it's like watching the water go down the drain, and the spiral, if it gets faster and faster and faster as you get to the end. Yeah. And I wonder what the correlation to that is, and I'm certain that there's a definitive correlation there.
One thing leads to another, and that's kind of and absolutely that's always going to be a concern. So
they used to say that it was a very high percentage of people who use the heavy drugs, the heroines and so forth, started on marijuana, but that was not to say that the people who use marijuana are in mass going to go and use the heavy drugs. So the reverse is not true.
This is nothing new, by the way.
With the flu.
My father died in 1950, and we found out, because we were in the dry cleaning profession, that our father was mainliner. And the way we knew that is the sleeves of his linings of his suit coats were caked with blood. And that was staggered. And I said to people in our plant, I said, just don't say a word. That's private business. Yeah. But then I realized, that's my father's. This was after my father has gone. And I said, that was my dad's doctor. Had I known that, I'd have had him out of that practice in a heartbeat. Yeah. So it's a deep-seated thing. It has been for years. It's gotten much more profound today.
Yeah. We're trying, as far as the opioids go, we're working with the police, and we're working locally to try to help those individuals that have issues with the opioids, the Safe Passages program with the police department. The philosophy there is, rather than if they come in and rather than incarcerate, help them, get the help they need to, to kick this drug habit. And so I think, from that standpoint, plus, the fact that the health department, we've educated the police to administer the naloxone for the Narcan, which counteracts the effects of opioids or heroin. Specifically, and so when there's been several lives saved just from our police administering that, so we're pleased to see the results of that. But we have a long way to go. Oh, absolutely. Yes. Yeah. A lot of it's education.
648-5510. I want to remind people out there, both of you listeners out there, feel free to call and just ask a question or make a comment to Mr. Don Cavi, who's doing a great job out there on 3rd Street in our Logan County Public Health Department. Don, what is your biggest challenge as we sit here in the studio this morning?
Well, and I can always tell you it's, finances. That's always going to be the big thing. We don't have nearly the grant dollars we've had the state just doesn't make it as available to us now as it did in the past. I mean, the health department, used to have 80 some odd employees. Now we're down to about 23. I think I told you last time our home health, we had to shut that down, unfortunately, after about 35 years. But I think right now, the biggest challenges we have now, because we are leaner and meaner, and we've got SIU in, and we're doing our part to promote access to health care for everybody with SIU in our doors. That opens up to the whole community just a whole variety of health services. Primary care, dental. So we've added that, but I think probably the biggest challenge is let's focus on with the opioids, and mental health is another issue, behavioral health. We find that's a real problem, and especially with a lot of kids, and maybe they're not brought up the right way, and they have social and emotional problems, and so I think those are some of the things that we're going to really try to tackle here in the community over the next few years. Right now, obviously, and I know, Judy, you mentioned the flu. And we're having a bad year this year.
Yes.
Right now, I looked at the numbers, and as of the 21st of January, we've had about 370 cases of flu this year.
In comparison.
Yeah, and I looked at the last 10 years, and I averaged it out. And, 1 year we had 14, and 1 year we had, I want to say it was about 380, 390, somewhere in there. So if you average it, maybe about 140 cases a year is what on a typical average, but we're well above that at 370 this year. And there's been about 35 people admitted to the hospital because of the flu. And unfortunately, sadly, we've had 3 people pass away. So it's been a tough year for the flu. The vaccine, I've heard anywhere from 10 to 30% effective. And the reason is there's this H3N2 virus strain going around, which is an extremely tough strain for the flu vaccine to hit. Now, I'm not saying don't get a flu shot, because the CDC is still recommending that everybody still get their flu shot, because right now the flu season peaks through February, so we're still in the heart of the flu season right now. But if you have that flu shot, it may reduce your symptoms if you do get the flu, or it may help minimize the number of people that are going to have to go to the hospital. So point being, you're better off having your flu shot than you're not. It always pays to get your flu shot. So again, the CDC is recommending that. So and in addition to that, I can't remind people enough, wash your hands. And, if you have an a child in your house under 6 months of age, they can't get vaccinated. So everybody else in the house should get their vaccine, because, we don't want to spread anything to infants. So it's just using common sense.
It's there, and it won't hurt you, and they claim it's never too late to get the vaccination. So you're just foolish if you don't.
Yeah, do you have any idea
go through May too?
How people, we all react differently. Happily, we're those people who don't have it. We just get our shot and go out the door, and that's that. Some people have a little reaction, minor, some a little major. Do you have any information on that, or certainly it's not a measurable thing? Well,
obviously. We have our nurses that they're experts in that area.
You sure do have good people over
absolutely. So if somebody has concerns about a reaction, or call the health department at 735-2317, and the nurses will they will let you know if there's any chances you'll have a reaction, or if you have a reaction, this is what you need to do. And I know when the nurses give the vaccine, if patients have questions regarding that, they'll be happy to address that with them. So,
if you don't have your whole family vaccinated, don't you kind of defeat the purpose?
Well, theoretically, maybe, yeah. The people that would be at risk in that family, if you have a family of 6 and 3 of them get their flu shots and the 3 that don't are going to be the ones that can are more than likely going to pass it to each other. I'm not saying the other 3 that had their flu shot are going to be 100% covered, because let's look at what this H3N2 is doing right now. But yeah, in theory, you're right. But it's simple math, everybody should get their flu shot. It's that simple.
Speaking of shots, Judith K.
Yes, sir.
If we don't pay obeisance to our good sponsors, they're liable to stand us up against the wall and shoot us. Go right ahead, Jim.
Dear.
And right back live in the studios here, WLCN 96.3. In case you hadn't looked at your radio dial, that's what you're on. Hopefully, more than 2 of you this morning. Our guest this morning is Judith and I try really hard to bring people in the community who make contributions to the community and who are important to our community. Certainly, the Logan County Public Health Department is. And Don Cavi has been kind enough to come up here several times, and we always enjoy it because we always learn something new, and that's the purpose of the Viewpoint, isn't it? Try to come up with something new each week. So, Don, you have a kind of a bullet point of list of things that you want to cover. So, I'll throw the baton to you right now.
Thanks, Bill. Yeah, we were just talking about the flu shot, and we do have plenty available at the health department. So I wanted people to be aware of that. We have both the regular dose and the high dose. Some people that are higher at risk may require the high dose. Their doctor may recommend it to them. So we do carry both. The fee for the regular dose is $35, and for the high dose is $50. So I just wanted to make people aware of that. Something we're doing at the health department, we just started this month. It's called FIT testing, and it's called, basically FITS is an acronym for fecal immunochemical test, which is a screening test for colorectal cancer. And one of the things that really, the reason why we decided we want to do this, some health departments downstate started a pilot program with this FIT testing, and it's basically a kit that people can come into the health department and take home. They submit a stool sample back to the health department, and the health department will check the nurses will look at the sample to determine if there's blood in there. If there's blood in the stool, that's an indicator that that person could be at risk for colorectal cancer. And after learning the statistics that it's the second leading cause of cancer deaths, colon cancer. And the others, I don't have the statistic, but it's fairly well known that a lot of people that in that age range of 50 to 75 that should be getting their colonoscopies don't. Well, this isn't a replacement for it, but it's the next best thing to it. So we wanted to make something available to the community where if they want to get screened for colon cancer, that they can come in and pick up this FIT test. So we do have that available, and the kit itself is free. So they just have to come in, pick it up, and the only thing we ask is that they bring it back with the sample. Because we
almost stupid, not foolish, almost stupid not to make avail yourself of that program.
Absolutely. I believe the recommendation is once individuals turn 50, the doctors recommend that they have a colonoscopy. I want to say it's either every 5 or 10 years what they recommend, but a lot of people, they just don't want to do it. Well, it's quicker, it's simpler. Is it as good a determinant as a colonoscopy would be? Probably not, but it's better than not getting screened at all. So I think it's really important that, and we hope people will start to take advantage of this. So the other couple things that I want to talk about, speaking of FIT tests, which we will have at the Wellness Expo, which is coming up. That's coming up on February 17th, Saturday, from 9 to 1. And that will be at the rec center, as it is every year. So there's going to be 60 vendors there. They're going to have giveaways. I have a list of some of the screenings that are available. And this is it's a partner program with the Parks and Rec Department, with Abraham Lincoln Memorial Hospital. the Community Health Collaborative and the Health Department.
A quick side note to that: there's a lot of people go to a lot of work to set those up.
Oh, absolutely. It's a lot of work, and we appreciate it so much. They do a wonderful job. So, but the screenings that they're going to offer, I'm going to read through the list because I don't want to leave anything out. Blood sugar, lipid profile, hemoglobin, which is the test for anemia and other conditions, blood pressure screening, pulse oximeter, which I believe that helps determine how much oxygen's in your blood, oral cancer screenings, bone density, then the body mass index, BMI screens, blood typing will be there, and also, as I had mentioned before, fit tests. The hospital has purchased some fit test kits, and they're going to bring them to the health fair. So thanks to the hospital for paying for those, and then they'll be free to anybody that comes in. They're going to do some other things too. They're going to allow you to recycle or bring in your cell phones, hearing aids, eyeglasses, plastic bags, printer cartridges, pop tabs, etc. So if you need anything to get recycled, they'll have it. Also, another thing is prescriptions, unused prescriptions. It used to be back in the days, people would just dump them right down the toilet. Yes. Well, and a lot of people rely on groundwater for their drinking, and, they've done some tests and some studies on groundwater, and they've actually found traces of various prescription medicines and antibiotics in the water. And so we're really trying to encourage people to safely dispose of their prescription meds, and they will have a prescription and over-the-counter drop-off people can bring their meds into at the wellness fair. So
now, short of excuse me, Judy, you had a finger up. Go right ahead, please.
Oh, well, that's okay. Go ahead. I'll wait.
Short of this availability of this to drop off expired prescriptions, what does the family do when they come up? Oh my God, this is 2 years old. And they find it in the back of the medicine chest, and they haven't touched it for a year and a half. Mm-hmm. Yeah, what do they do with those on a regular basis?
They can drop it off at the health department. Matter of fact, we have a drop-off site at the health department. People can bring it in, and we will gladly take those. I do believe, I don't know if there's, you could check with the pharmacy. Some pharmacies in town may do that. I don't know off the top of my head. I can tell you on our behalf that we do. If anybody has any meds they don't need anymore, they can drop them off at the health department.
It's smart to get rid of those things that nobody's going to use. First place, they take up room, and in the second place, whether you have little children of your own, you're liable to have, like Bill and me, grandkids, great-grandkids, generations.
Did you ever tell you about my grandchildren?
Through the house. Oh, yes, I think you might have mentioned it in passing. Another thing that you have that I was unaware of is your Medical Reserve Corps. Mm-hmm. You want to talk a little minute about that?
Yeah, that's we at our health department, we have an emergency preparedness coordinator, and she does all of our response activities in the community because we do a lot of work with the local emergency management and the police and the fire. For instance, if there was some kind of a major outbreak, the health department, we may be responsible for setting up a kind of a makeshift dispensing site to make sure people get their meds, and the state, they have emergency supplies of things. So we would work in a capacity like that, or if there was some major medical emergency in the community where medical personnel needed to come in and help out in an event. That's where the Medical Reserve Corps comes in, our emergency preparedness coordinator, who also does all of our health education programs. She is developing a core of a group of volunteers in the community, medical personnel, and we're very appreciative of the fact that these personnel have volunteered their time and services in the event there is an emergency. So that's what the Medical Reserve Corps does. They're there at a moment's notice if we have any major emergencies in the community. Mm-hmm. They may be doctors and nurses or other related medical personnel. So, but that's what the Medical Reserve Corps is, and we are responsible for recruiting them and training them and getting them involved. So.
Did you see on the news the other night Steve Siltman was talking about taking a patient to Springfield in the ambulance, and some Hanyaks dropped a rock off the bridge and it went through the box of the ambulance. Thankfully, it didn't hit the patient back there. I mean, if you're sick enough to be going to Springfield in an ambulance, you don't need a rock in there, too. I don't know. Sometimes people just amaze you, don't they?
Yeah.
It's what Judge Trapp said years ago.
Yes.
People are no damn good.
That's right.
Yeah.
Judge Trapp nailed it.
Yeah. But, we, and those are just some of the things the health department does. We, there's, 10 essential services we do. Sometime when I'm on your show, I'd be happy to go into that in more detail. But, we're not just the place where people get their immunizations, or we're not the place that, we send people out to inspect the restaurants and the wells. We do so much more than that. It goes beyond that. And at some point, I'd be happy to share with everybody, what we do for our 10 essential services.
One thing, you have your website, and on there, people could look and see what score all the eating places around got on their check by the health department.
Yes. And that's how often you make that rounds with the establishment? Well,
it's based on risk. Certain food establishments have a menu with more high-risk meals in there. For instance, meals that involve a lot of ingredients, a lot of potentially hazardous foods like your meats and your high-protein foods. And let's say they have a complicated menu where the food they prepare, they have to go through a lot of heating and cooling steps to prepare that food, like chili or something, or certain types of salads that require a lot of different ingredients. If they're a high-risk facility, we have to be in their doors at least anywhere from 2 to 3 times a year.
Really?
Whereas if it's a low-risk facility that serves or sells food, I'll give you an example of a low-risk would be like a convenience store, because they're not opening food, they're selling prepackaged food, albeit they do sell, milk and other potentially hazardous foods, but they're in a refrigerator. It's safer. That's a low risk, and we'd have to go in there, once a year. So the frequency depends on the risk.
Culver's has a program whereby if your organization will send some representatives to help with the rush hour on a given day, they give you a part of the proceeds, and that's
great
Culver's
cause.
All over, and it's a darn nice thing for organizations.
Great thing.
Yeah, I worked out there the other night for the Oasis. And by the way, we had a good time, in case you're interested. But at any rate, they were checking on where the ice cream was and where all the things were. They were checking the temperatures on these things right along. So they're very careful.
Yeah.
Your
and we
exams are pretty
appreciate
stringent, really.
Yeah, we appreciate that. And, restaurants, food establishments have to be accountable for what they do. And our job is, when we go and inspect these facilities, we not only do that, but we're educators. And we want to make sure that we can empower these people enough that they take control and that they know exactly when to check their temperatures, when to wash their hands. So a lot of work goes into that. Now, you mentioned inspection scores too, and I know down the road, the state actually next year, they're adopting the Food, Drugs, and Administration FDA food code, and we're going to be doing inspections similar to what the FDA does, and they're non-scored inspections. So after this year, scores are really not going to exist anymore. It's going to be they're either in compliance or they're not in compliance. But we're going to pay attention more to how they're handling the food, and on our inspections, we list what they're doing wrong, what they're doing right. It's still all there, and I'm sure we'll figure out a way to get that out to the public so people can see how significantly in compliance a facility is compared to others. But that's going to change, and you're going to see that in the next year. So
is going with the FDA's system a step up or a step back?
I think it's good because people tend to think, well, they get very reliant on scores, and I can give you an example here. Let's say if you have a restaurant that has you got 2 restaurants, and let's say we've inspected both of them. let's say one of them gets a 90% on their score, because we go in, we assume they have 100, but we start marking off things and we deduct the score. Let's say that one facility ends up with a 90 and another facility ends up with a 95. Okay, well, people are going to think, well, the place that got a 95 is probably the safer place to eat. Well, here's the thing. If that place that got a 90, if all their violations are minor violations, for instance, maybe the floor's dirty, maybe a light shield is broken, something that's not going to make somebody readily sick, let's say those 8 or 10 violations culminated, they're minor violations, but you've got the facility that has a 95, and let's say their violation was that their food temperatures throughout their facility they were in the danger zone. Let's say their chicken or their beef was held at 70 degrees at room temperature. Well, then you got to think it through. Where's the safest place people are going to eat? It's probably not the place that got the 95, because if you ingest meat that is, in the danger zone and all that bacteria is time to grow at room temperature, people are more likely to get sick from that than having a little dirt on the floor, or having maybe some type of a non-food contact surface that's maybe has a scratch in it or is in disrepair.
Oh, sure.
That's not going to make anybody sick. So
no.
I think I kind of like where it's going. I really do. I think it's going to take time for people to get used to, because again, we got to see numbers, and we're just going to have to adjust and realize that it's not going to be that way. So
it's hard to teach us old dogs new tricks.
Judith, time is about to expire, and I hope we don't expire before the time does.
Could happen to
in my
us.
case, Anyway, seriously, Don, aside from financing, which is an everyday problem for you there, and in all agencies such as yours, is there one glaring need that you find unfulfilled in your department?
That's a good question. What sticks out of my hand, in my head, is that it's just the needs of the community, and the need. I want to see how we can maximize our potential to address those needs, and that's really in the back of my mind most right now. And that's where I'm at. I look at what's going on in the community and some of the issues that we have, especially with our children, and some of the behavioral health issues and the opioid issues that we're having now. And I want to see that people overall are taking better care of themselves, and I want to make sure that the programs we have, like our nutrition programs and those types of things, are really helping people, so down the road we'll have a healthier community. So I'm kind of looking at it as the big picture.
You've had to have staff reductions of necessity due to financing. Having said that, our community is still very well served by your existing staff. I speak from experience when they go in there to get shots. It's so simple, and you're out of there. If you think your time is important, it's not going to be to you when you go in there. They take care of it right away without hurrying things up, and you're in the door and out the door before you know. So,
it's really maximizing. My biggest concern, I guess, and if I could, is trying to maximize how we can resolve the issues of the community with the minimum resources that we have, and it's going to take partnering and working together, a comprehensive community effort. And I guess in my mind, I keep thinking, somewhere down the road before I retire, how can we maximize that? So, if I could too, before we're done, I was going to mention that our hours right now, as we talked about, speaking of funds, we were on furlough days. On Fridays, we were closing at noon. Well, beginning April, I have good news. We're going to be open full-time again, Monday through Friday. Fridays will be in until 4:30. So
good for you.
This is in April, starting in April. So I just wanted to get that out there.
It'll be April before we know it.
Yes, it will be.
April in Paris.
No, Lincoln.
Judith, do you have any questions before we conclude this little clam bake this morning?
No, I'd just like to join you in thanking Mr. Cavi for coming out this morning. Bless your heart.
Oh, thank you. Can I say one last quick thing?
Absolutely.
Yes,
We're working with SIU, and I know they're doing a lot of work with the Veterans Assistance Commission. I know Bill, you appreciate this, and again, we're always thankful for your service to the country. There's a dental program that the VAC and SIU have an agreement on. It's for veterans. It's a dental exam and cleaning service, and if the veterans don't have insurance, it's a $25 out-of-pocket service. It's typically a $75 service.
Minimal.
The SIU is going to kick in $25, and the VAC is going to kick in $25. So it would only cost the veteran, like I said, $25 out-of-pocket to be for cleaning and exams. So that's something new that they're working on. And I know SIU, they're a physician. They're in the clinic, I think, 3.5 days a week, and while they're there, they're not going to turn any veterans away. Every veteran's welcome, but I do know the primary care physician there is TRICARE credentialed. He just got his credentialing for TRICARE, and I know a lot of veterans have TRICARE, which is good, so they're going to be able to assist and build TRICARE.
That's great.
And we as the health department, we are a TRICARE provider too, so I just wanted to get
Another
that out
plus
to everybody.
service by the Logan County Department of Health. Don Cavi, we appreciate you being with us again this morning.
Thank you.
We try to get the word out, and your articulation is able to enhances our ability to make the people aware of Logan County Public Health.
Well, thank you very much. I really appreciate it. I do.
We always try to close with a comment that hopefully is analogous to the subject matter. And you can say that Steve Forbes said this, but I could almost see Ronnie Reagan saying it. The real cure for what ails our health system today is less government and more freedom. Thank you very much, Don Cavi.